Dr. Anersha Pillay, board member of the South African Society of Psychiatrists, joins us now for this conversation. A very good evening to you. Thank you so much for speaking to us. I know it sounds like I've read the whole summary of problems, leaving you with not much to talk about, but perhaps let's just delve into the minutiae. When we talk about schizophrenia, what exactly are we talking about? Because for a lot of people who don't even understand mental health illness for one, just drilling down to the understanding of schizophrenia is a difficulty.
Yes, it is. Thank you so much for having me. So essentially, schizophrenia is quite a debilitating mental illness, and it's characterized by what we call episodes of psychosis. So what is psychosis? Psychosis actually involves symptoms where patients experience hallucinations. So they may see things that are not there or hear things that are not there. Perhaps even smell things that they can't account for. And in addition to that, they have what we call delusions. So delusions encompass thoughts that actually don't have a basis in reality. For example, cameras are watching me in the room, things like that. And in addition, we also see disorganized behavior. So they may be hoarding, or they may be collecting rubbish, or certain disorganized events, not taking care of themselves, etc. And sometimes in the way they communicate, they may not be able to actually come across as conversational or what we can understand them saying. So this is quite a chronic disorder, and these episodes occur from time to time. And if it's not treated and the illness as a whole is not treated comprehensively, these patients tend to deteriorate. And this impacts on their social functioning, their occupational functioning, as well as their interpersonal functioning. So it really is overall quite a severe mental health disorder.
And the causes, are they myriad, or does it follow, for instance, if one has PTSD, say maybe from a childhood trauma or something that has happened in their life that would cause such episodes? Is it genetic? What are the causes?
So, as you say, rightly so, there are a myriad of causes, and genetics play a part in it, definitely. There are theories that viral infections during pregnancy can impact on the development of later schizophrenia, as well as major stressors either during childhood or sometime in a patient's life. But there certainly is a predisposition. So not everybody gets schizophrenia. And in fact, the worldwide prevalence is thought to be about 1%. And we assume that that is the same for South Africa because these studies have been done across multiple cultures and countries. So it's very difficult to really predict, but we do know that if there's a genetic history, the predisposition does lie there.
And I'm just curious about particularly misdiagnosis. We've seen incidents where people have either through years of excessive drug taking, such as taking spiked marijuana or whatever, have presented with certain symptoms which may be accused as one with schizophrenia. Does that happen often? Are there surefire ways of diagnosing it and treating it?
So the distinction, it really starts with understanding that if a patient has psychosis due to substances, then removing the substances should resolve the symptoms, and the patient should not experience further symptoms unless exposed to the substance again. However, continued substance use is another risk factor for schizophrenia that we have seen, and that is because it causes long-lasting changes in the brain chemistry that predispose to schizophrenia. On the other hand, patients with chronic schizophrenia often use substances as a means of coping. And this is really because, they don't have access to care. They don't have access to an understanding of their illness or what they are actually enduring. And they do find sometimes solace in using substances as a means of coping. Unfortunately, the use of substances does worsen the prognosis in schizophrenia. So essentially treating schizophrenia is treating any comorbid substance use as well.
And you were saying that it's important to have holistic treatment. What exactly do you define that as?
So essentially, as it stands in our healthcare system currently, whether it be in the public sector or the private sector, there really is an emphasis on hospitalization of patients with schizophrenia, and primarily when they reach a very severe stage of their illness. And our feeling is that we should be identifying these patients at a much earlier stage. And when we use holistic treatment, we implement treatment a lot earlier. We educate the family. So we obviously have to have, other mental health care providers involved, not just psychiatrists or doctors, but nurses and occupational therapists and psychologists to help them walk this path of what is potentially a chronic, very debilitating illness. Now, in many of our community clinics, there aren't even facilities for clinical psychologists to be accommodated. And we find this a problem because then it enhances the stigma that exists towards illnesses like schizophrenia and mental health in general. So for comprehensive treatment of schizophrenia, you need a full team. And our mental health team consists of a number of individuals that I've mentioned. But this is really scarce resources, particularly in the community setting.
All right, and just very quickly, for us to remember as a takeaway on Tuesday, changing our patterns, embracing people so that it no longer is stigmatized.
I think it starts very much with education. We need to educate ourselves. We need to educate the general public about mental health disorders, particularly schizophrenia. There's tends to be a perception that patients with schizophrenia are violent and problematic, and that is not necessarily so. If they have access to good treatment, if they are stabilized well, they function in society just like anybody else can function. So I think it starts with good education, destigmatizing mental health, and understanding that mental health can occur to, disorders can occur to anyone. It's not specific to certain groups or certain cultures.
Right, I really appreciate.
So I'm really hoping that for Mental Health Day or World Mental Health Day, we will start to embrace mental health as part of general health.
Dr. Anersha Pillay, thank you so much for speaking to us.